Hi, Dr. Klaiman from Point Performance. I'd like to welcome you to a first video in a series of spine imaging videos that we're going to be doing for you. And today's example is one of the lumbar spine or the lower back. And I'd like to take you through some relevant anatomy, give you a bit of an anatomy lesson, show you what the lower back or the lumbar spine looks like on an MRI, and then give you an example of what kind of problem can exist in the lumbar spine. So if we take a look at this image first, this is referred to as the sagittal image or side view. This is the back of the body and the front of the body. This lighter contrast here actually represents fluid, or excuse me, this is fat that is underneath the skin, we refer to as the subcutaneous fat. This is actually the spinal canal, and this is fluid that is running up and down the spinal canal. This gray structure here is the spinal cord, which you've all heard of, and the spinal cord is suspended within the spinal canal. The spinal cord typically comes to an end around between the first and the second lumbar vertebrae. So counting back 5, 4, 3, 2, 1, spinal cord comes to an end around here, and then what travels below the spinal cord is a horse's tail of nerves, and you can hopefully see a couple of strings down here, darker strings, which actually represent nerves that are traveling down the spinal canal. I'll point you to these spherical shaped structures that exist between the vertebrae. Those are the intervertebral discs. You've all heard of discs before, and these are examples of healthy, beautiful looking discs. Normally as we go down the spine, the discs get larger in size. This one is larger than this one is larger than this, and so forth as we go down the spine. The discs are lighter in the middle because they're very well hydrated, and they're darker on the outside because there's fibrous tissue that surrounds the disc, and that appears dark on this image of the MRI. So these are all examples of beautiful, healthy looking discs, and I'll point you down to this level. This is the disc between the fourth and the fifth lumbar vertebrae. Pay attention to this structure or protrusion right here. This is actually the disc that is sticking out into the spinal canal. We refer to this as a herniated disc. I know you've all heard of that before. This is what a herniated disc will look like on a sagittal view of the MRI. If we wanted to get another view of what that disc is doing at that level, we take what is called the axial image of the lumbar spine. That's what we're seeing on this side of the screen. And that allows us to view the disc in a slightly different way. You're almost looking straight down on it now. So here is I'm encircling the disc. This is the spinal canal with the clear fluid running up and down. And then if you can make out this circular protrusion over here, which happens to be on the left side, that is the disc that is herniating out into the spinal canal. This particular patient presented with not only lower back pain, but pain that was traveling into her left leg. And we determined that in this case, the protrusion at this L4, L5, or the fourth and fifth lumbar vertebrae, was responsible for the pain that she was experiencing, not only in the back, but radiating down the leg. And the reason for that is that, again, remember, these nerves are traveling up and down the spinal canal, and these nerves actually they exit on both sides. And in this case, the herniated disc was compressing or irritating the spinal nerve at that level, causing symptoms that were traveling down her leg. So this is an example of the lumbar spine or the lower back and its relevant anatomy, and one example of what can go wrong with an intervertebral disc. So thank you for tuning in. We welcome you back for another video series that will include other anatomy and other kinds of problems that can present in either the lower back or perhaps the neck. See you next time.